MIRSC, or Minimally Invasive and Robotic Surgery Center, is where patients can avail of the informations regarding minimally invasive surgery as well as our robotic surgery. It is a place where patients can go and be able to get all the informations that are needed, especially most of them, they wanted to know what is minimally invasive and what is robotic surgery.
That the advent of laparoscopic cholecystectomy was the single most important stimulus to the expansion of operative laparoscopy in surgery. Various operative procedures have been performed laparoscopically. In St. Luke's Medical Center, Quezon City, we had a total of 680 cholecystectomies in 2014, 83% of which were done laparoscopically, which was equivalent to 571 cases. We have only one conversion, which is equivalent to 0.15%. Conversion to open is way below, compared to the 4.5% of the international benchmark.
We started robotic surgery here at St. Luke's system in September 2010. I did the first procedure in the system, and that was an esophagogastric Nissen spoon duplication for somebody with reflux disease. And ever since on, up to the current time, we have done about 416 scheduled and 406 successful robotics procedure on all specialties, and these are mainly due to the preciseness and the 3D vision that is robotic surgery is capable of.
The Minimally Invasive and Robotic Surgery Center is quite a unique center actually, because it represents the different specialties of the hospital that provides or has minimally invasive surgery services.
Regarding laparoscopic procedures in general surgery, the most commonly used laparoscopic procedure is for cholecystectomy, appendectomy, hernia repair, colon surgery, gastric surgery, and even in the esophagus we utilize it. Here in the center, there are really limitless utilization of laparoscopic procedure.
We can boast that St. Luke's Medical Center up to this time has been doing the most number of arthroscopic surgery for the knee. The estimate would be no less than 500 cases a year, including just arthroscopic meniscectomy, ACL reconstruction, okay, mainly for the sports-related injuries.
Minimally invasive procedures for the lumbar spine includes tubular decompression and minimally invasive fusion surgeries. Patients with chronic back pain, with leg symptoms, patients who have been diagnosed with slip disc, with lumbar stenosis, or basically patients who have impingement of their nerves in the lumbar area are good candidates for minimally invasive spine procedures.
Next is minimally invasive gynecologic surgery. It is the gynecologic branch of endoscopic surgery. This is used to evaluate the pelvic organs through a keyhole opening on the abdominal wall. For hysteroscopy, you have polypectomy, so any pathology in the uterine cavity can be accessed by MIRS through hysteroscopy.
You know, we could boast of the most modern instrumentation we had with the minimally invasive section. And of course, we had acquired a robot 5 years ago here at the St. Luke's Global City. And I would say that as of now, we have been doing a lot of robotics. As far as the Philippines is concerned, we are the #1 in doing robotic surgery here in St. Luke's or in the Philippines.
Locally, we are at the forefront. Internationally, we could even be performing more than some hospitals in the ASEAN countries. Definitely.
Well, we really have a very broad base in terms of minimally invasive surgery, or in neurosurgery we call it MINS, minimally invasive neurosurgery. It covers like the gamut of patients with tumors, patients with let's say aneurysms, patients with hydrocephalus, patients with spine problems, even patients with strokes can already be done through a minimally invasive neurosurgical procedure. They go home after 2 days and it's just like they did not have treatment. And now, even for aneurysms, we also are able to offer what's known as endovascular coiling of the aneurysms, and the outcome is really very, very good.
The trend now in vascular surgery, just like any of the other surgical specialties, to go minimally invasive. In vascular surgery, particularly for venous procedures, numerous procedures are now being done as an outpatient clinic-based procedures. For instance, we have the endovenous laser therapy, which falls under the endovenous ablation.
The most common ENT HNS minimally invasive procedure would be the endoscopic sinus surgery. The next would be balloon sinuplasty and also endoscopic laser surgery of the larynx. We are the only institution here in the Philippines that offers this. We usually do this for early cancers of the larynx, stage 1 and stage 2.
In urology, we divide the minimally invasive procedures into 5 categories. We have endoscopic surgery, we have shockwave lithotripsy, we have laparoscopy, we have percutaneous surgery, and robotic surgery.
Many of our patients who can avail of the most common robotic procedures are those with prostate cancer. With the robotic technology and the robotic platform, we are able to better dissect and better take out the prostate and at the same time preserve vital structures that will keep our patients functional sexually and continence-wise. Aside from prostate cancer, we've also applied robotics for kidney cancer, specifically those who are undergoing what we call a partial removal of the kidney that is affected by a malignancy. So now we can actually offer a technique that can minimize blood loss, make it a safer procedure, and again preserve more kidney function.
The Advanced Surgical Training and Simulation Lab was developed to address the different training programs of the different specialties. The MIRSC actually facilitates the different training programs that these specialties are offering. And with this, we help in trying to centralize all the training, promote them, develop them, and we even innovate them in order to further improve as well as elevate the level of skills of our experts.
Now, the future plans of the Institute of Surgery at St. Luke's Medical Center, Quezon City, is to be able to perform more complex surgeries such as laparoscopy, laparoscopectomy, liver resection, pancreatic surgeries, and complex biliary operations.
Regarding minimally invasive surgery, St. Luke's is going to be in the forefront, the leading institution to deliver this kind of services, and I think we're going to be the benchmark not only locally but also abroad.
Minimally invasive robotic surgery, it was developed for the patients and to address the patient's needs, and we will provide the best surgical expertise through the continuous training as well as the latest and cutting-edge technology such as robotic surgery at St. Luke's Medical.